Yes, Maggie, my friend. The first one in the platform is my friend Maggie. Today we are talking about arrhythmias. I'm going to introduce a topic called arrhythmias of the heart. The heart arrhythmias. Heart arrhythmias are are some irregular heartbeats. Yeah, and we have to. There are several types of irregular heartbeats, and we're going to talk about them. We have different types of arrhythmias. Not all arrhythmias are just arrhythmias. We have different types of arrhythmias. And hey, hi Maggie. Yeah, thanks for tuning in the platform. Now, what are arrhythmias? Arrhythmias are abnormalities. These are abnormalities in the rate, rhythm, or conduction of the heartbeat. The rate, rhythm, or conduction of the heartbeat. The way your heart conducts. See, I'm going to explain how these things work. Your heart has an electric pulse. Your heart has got an electric pulse, and this electric pulse is what keeps the heart pumping. It's what keeps the heart pumping. We're gonna look how this electric pump works. Get it? It's not just like the heart is configured to be pumping without any communication somewhere. There are some communication ways that this heart needs, and they are electrical, and they need sometimes. Yeah, okay, okay. uh, there are some ways in which your heart pumps, and there are some things we need to learn before we start going to specific terms like you see, how can I sit today like this, yes, and then bring this closer to me, yeah, that way. Now look at this heart. This heart is not like the other heart that we learned. This one we were dealing with it on circulation of blood, how blood gets to the lungs, and then it comes back, and then it is pumped to the system. But this heart here, the one that you are seeing, this heart here, this one has another green thing that you are seeing, this green. This one is the bundles that they are like, let me say, they are like wires of the heart. They are like wires. So there are two nodes that create the electric impulse of the heart. You get it? They create impulse of the heart. Now, if you look here, we have this one, this node, the bundle here, which is called the sinoatrial node, and then we have another one here, which is called the atrioventricular. So this one is the one which starts. It creates the electricity. It releases the electricity, and when it releases the electricity, it is passed to the other side of the heart, this side, and the other comes down here to the sinoatrial node. And there are some terms we need to learn about these electric impulses. There are some terms we need to learn about these electric impulses. When this, let me explain of something. When your heart is contracting, you remember when I was talking about this heart, but blood comes here and then it drops here. What makes the blood, this atrium, to contract? Thanks, Margaret in Norway. What makes this heart to contract so that blood can come down to the ventricles to be pushed away from the heart? Let's see what makes the blood to contract. There are several things that makes the atrium to contract, and I will I will talk about two terms that are, one is called, I'll talk about the depolarization, and and repolarization. Repolarization. Now, there are two terms here. One is called depolarization. The other one is called repolarization. These terms have totally different meanings, and I want to explain slowly, so that you can understand the two terms and what they mean. Now, what is depolarization of the atrium? Because when blood is this atrium is contracting to push blood, it is called depolarization. What happens at that depolarization stage? You see, this one is depolarization. Yeah, I put here. Hope it will not destroy. No, here, yeah. Here people can see depolarization and repolarization. Now, I will draw here a cell. Here, a cell. This is a cell, and with positive outside, positive. These are cells, muscles. You know your muscles are made of cells. Your muscles are made of cells that are surrounding, these are making this muscle here. So the cells of these muscles, I want to explain something that is very important, so that when we are going to talk about arrhythmias, how the heart beats, you understand what I'm saying. So this one is positive inside, and I'm drawing something to explain to you what I mean as negative outside. Now your cells are made like this. During depolarization, the positive sodium is made of positive. You see, sodium is written like Na positive. It has positive ions. So when you are the atrium is contracting, it means sodium is getting inside the cell. Sodium is getting inside the cell. So if positive ions like sodium get inside the cell, this atrium contracts. This atrium contracts. But when negative ions get inside and positive ions comes outside, we call it repolarization. It relaxes. So that one, you note, I go slowly like depolarization is a process whereby sodium, which is positive ions, gets inside the cell and negative ones get outside. So when positive ions like sodium gets inside the cell, your muscle contracts. So when it contracts, it is able to push blood away. So we call it depolarization. Depolarization is taking positive ions inside the cell so that the muscle can contract. So we've seen that. So when it contracts, we have talked about depolarization. So repolarization is the negative, getting negative ions from inside, getting negative ions from inside to outside. It is called repolarization. And during depolarization, what happens during repolarization? What happens during repolarization? In depolarization, muscle contracts. And repolarization, the muscle relaxes. The muscle relaxes. You get it? So when this muscle is contracting to push blood down to the ventricles, that one is called repolarization because it is contracting. Positive ions have gone inside the cell and the muscle is contracting. So when repolarization occurs, it means the positive ions have gone outside the cells of the muscle. So it relaxes. So that when it relaxes, it is giving way for more blood to come inside. This is a very important thing to note. But when we turn back and we look at the picture here, This one, we are talking about the sinoatrial node. So when the sinoatrial node hits, it means depolarization. Have you ever seen something in, don't know if you will see, let me see. This one. Have you ever seen someone, you have gone you have told, go to do an ECG by a doctor, and then you see something like this. I hope you'll see. And then you see something like this. P wave goes up and then comes down, goes like this, goes like this. An electrocardiogram. Have you ever seen an electrocardiogram? These electrocardiograms, what they mean is, when today we are really learning of some complicated terms, though you will just bear with me. When the atrium, the sinoatrial node, this sinoatrial node here hits, when it hits, what happens is it creates electricity. And when you are putting those strobes that you put, it creates this. This one is called a P wave. So when you have, we will learn about the EKG. EKG is ECG of your body. So when you put the ECG on the body of a person, this is how they are put. We will learn about them here. You understand? For those who have done once in life, when you put them like that, what happens? Here, the V1, the drop that is placed, it is reading electric impulses here at the right atrium. And when the right atrium, this sinoatrial node at the right atrium hits, yes, it's like electricity system, positive and negative poles. Yes, uncle, I do electric installation. I have some little understanding. Yes, uncle, that is what I mean. When positive gets in, the muscle contracts. And remember, when you have an ECG, there is something called a P wave. When a person is sick and the doctor tells you now, go to do an ECG, an electrocardiogram. What those electrocardiograms do is this. This. Look at this picture here. Jamaican uncle Boswan, welcome. Look at this picture here. They have placed V1, 2, 3, 4. These ones are called AVF. The AV foot. We will learn about that. It's an introduction. Let's introduce. And we have some surprise vlogs. Welcome, Boswan. Welcome. Jamaican uncle is always in the house. My sister Meg from Norway, always in the house. Thanks. Today I'm going slowly by slowly. So we have moved from electric circuits to the other heart of the blood. So get this. I've told you that now go to your heart seems to have a problem. Go and see a cardiologist. I need an EKG. An EKG is this. Let me show you. It's those probes that are placed in your chest, and then they read the electric impulse of your chest. They read the electric impulse of your chest. So when you have a problem in your heart, the electric impulse that they read are these ones. The sinoatrial node. They read this. So when it is the sinoatrial node hits, it brings, remember, it brings in the cells of this muscle of the atrium, it brings positive sodium ions inside the cells. It brings sodium positive inside the cell. That is called depolarization. And this atrium contracts. So when the atrium contracts, we form something called here, this thing that I've drawn here, a P wave. We call it a P wave. So after it has contracted, there is P wave. Remember, it has, remember, the sinoatrial node has released the sinoatrial node has released an impulse, electric impulse, sodium ions have gone in the cells and it has contracted, pushing blood from this atrium down to the, allowing it to push. So this is what happens when it pushes. There is some time that is taken from this node to this so that it can push down. I'm introducing the normal. This is the normal. So when the electric impulse takes time, it takes time. This anteroventricular node takes time so that all the blood that is inside the atrium can go to the ventricle. That time is this time here. This time here. This time here. You see that? It's that time, the time that you are seeing, it's a flat line. Just a minute. That flat time that you are seeing, that is the time that it is flat, it is taking time to pass. So we go to another Q wave. Q. P. Q wave is here. Q. So from it has the sinoatrial node has given an electric impulse. And then after it has given an electric impulse, this one takes time. So we have a flat line before we go to Q. But after it has this one has got the electric impulse in the heart. Now it supplies, it sends the signals, it supplies to your heart. Now this one has contracted, blood has gone because sinoatrial node has sent the signal to this one, atrioventricular. So after this, nodes are opened and blood is flowing. The tricuspid valves, after all the blood has gone, this period that we have said is a period of P to Q wave. After it has, let me push, I want everyone to see that. This period that you're seeing down here is PQ. Another electric impulse comes in. What is this electric impulse? The electric impulse is this one, R. Now R, this one peaks. And where do we come to get the P, the R? The R is from the sinoatrial node dropping down to here. Dropping down to here. That one is a very long line. It comes from Q and then we go up. We go up. Are you seeing that well, my people? I know some people have seen these things or in hospitals, in hospitals, with a friend, a father. Let me draw it down well, because I think, are you seeing it well here? If you are seeing it well, please tell me. Now, I've said, you see, Q is from this node, Then what will happen next? Yes, I want to you see that correctly. If you are seeing it, welcome. Now, when it has contacted, now we are at the wave. You see, we are talking about electric waves because now your chest is polarized with electrons. It's given these electrons to study the waves. So when the waves come to this atrial node, it drops down. That is another wave that has come, which is called R. Which is called R. You get it? Which is called R, the R wave. And then when it is feeling now to the other part of the ventricle, you see, this is, let me say it as a caricature, like a cartoon, like you see that contractions. You take time, and then So that one is an R wave. You see, P, contraction, sodium ions positive inside. It is taking time to take electricity because when the electrons are passed here, it is taking time. Blood now is flowing because the atrium is contracting. When sinoatrial node says, the electric impulse sodium goes inside, positive ion. It drops now to the ventricles. You get it? After the ventricles, it spreads. Now from here, that is where we get PQRS. Now S is here. And we have another S. S is here. S is here. Down. But the ventricles are still pushing blood. You know, when the signal goes, they contract. Where the signal goes, it contracts. So when it contracts, what happens? Blood is being pushed now to the body, and some blood is going to the lungs. And then there is a stale time where the ventricle systole, the ventricle, it is called the systole, are holding on to push more blood. It is the T. It is called the T, where it is polarized, but we still, the ventricles are pushing the blood. The ventricles are pushing the blood. So this one comes to T. If you have ever seen that, let me explain in a funny way, the PQR complex. The PQR complex contracts, that is P, and then the atrial node takes the electricity. It has peaked. It stays for some time, the flat line. Let me draw it here so that you can see the flat line. Thanks, boss one. Then P, Q, T. Now, let me explain it this way. You see this? Greetings to you, King Ray. You see this one? Now, let me put it here. Electrons have been, the sinoatrial node has produced electrons. Now, this atrium has contracted, and then it pushes. That is, when it just releases the wave, this is called the P wave. That electricity removal causes the P wave in the gadget that you have. And then when it comes down here, it takes time, so that if it releases faster, the electrons, this one will relax and blood will remain here. So it has to take some time, blood to come here. So that is the Q. It is Q wave. It is the Q wave. Then the electrons go up to here. You see, this is a long track. So that's why in electrocardiogram, this is R, because it is a long track. And then after R, we have the other one. The bundles now R, we come to S. That is a wave that those probes that you are putting in your chest. Please, if you have not liked and you are here, my friend, today we are learning about how your heart beats. If I'm complicated, say, but because I want everyone to understand how the heart beats. If you were my biology teacher, could have scored an A. Welcome, my sister. Hey. Now, biology today is coming through, Yes. So after the S, when the ventricles have contracted, they will still have to hold on blood so that it goes to the lungs and the systemic. So that is called depolarization still, and we have the S, the T wave. So, my friends, you have ever seen this thing? Some things that you put probes, they are called echo. It's called an EKG, not an echo. An echo is an ultrasound. It's called an EKG, electrocardiogram, that reads how your heart beats, that reads how your heart beats, my friend. You get it? So we are at good. Now you understand how the signals of your heart are coming out. Now you understand? You understand how the signals flow. And you see, these are automatically, we call them sympathetic. They come by themselves. You cannot program them. So you notice that when the sinoatrial node hits, it takes sodium ions which are positive inside the cell of the inside the cells of, sorry, today I'll have to move inside the cell of the atrium. So when sodium ions are inside the cell, this is what is called depolarization, and the depolarization leads to contraction. Depolarization leads to contraction. So this atrium contracts, forcing blood to come here. You get it? Forcing blood to come here. And this one is receiving the electrons, ready to push them away. You get it? Now, that is how it is. Just know, when sinoatrial node receives and then it is pushing, when the waves are going on, it is contracting. So when it has taken time and contracted, it relaxes again, the step starts again. So when it's relaxing, it is called, when it is relaxing, it is called repolarization. Repolarization, my good friends. If you have a question up to there, thank you. I'll be like to thank you. I would like to go there. Thanks, Uncle. When you come to Kenya, and take you there. Where? Okay, we will see. Now we continue. We want to study about some names, about some things here. They are very important things. Arrhythmias. We have said arrhythmias are abnormality of the rate, rhythm, or conduction of the heartbeat. That one I was just explaining. Abnormal. Wait a minute. I was explaining a normal circulation of blood, of electrons through your body. Now, we want to learn about now the opposite, because what I've been telling you here is I have been telling you here is the normal. So let's learn about the opposite, which is not the normal. The normal is arrhythmias. And what are arrhythmias? Introduction to arrhythmias. What are arrhythmias, my friends? Up there, you won't see them well. Here? Yes, there we see them well. What are arrhythmias? Arrhythmias, we have said, arrhythmias are abnormality in rate, rhythm, or conduction of the heart. So there are several types of arrhythmias, and one type of arrhythmia is called tachycardia. Tachycardia. What is tachycardia? Hope everyone is seeing well. What is tachycardia? Tachycardia is fast rate, beating in faster rate, faster. And tachycardia is divided into two. Greetings to Benjamin, the blessing to all the chat. What controls the signals? But I got the answer. You have said it's automatic, regulated itself. Yes, the muscles of the heart are regulated themselves. They regulate themselves from the sinoatrial node. Now, tachycardia is abnormality. Your heart should be beating between 60 to 100 per minute, beat per minute. But when it goes above 100, that one is tachycardia. It's beating faster. So there are two types of tachycardia. It depends with where they are. You see, the first type of tachycardia is, so we cut here, from here going up. That is auricles. Here is ventricular. So the first type of tachycardia is when the sinoatrial node is beating so fast, sending signals so fast. So we call it, if I was young, I think I would be a doctor because you explained so good. Thanks, uncle, thanks. So when this sinoatrial node is beating too fast, it is called sinus tachycardia. Sinus tachycardia. It is called sinus tachycardia. You get it? When it is beating too fast, it is called sinus tachycardia. You check it out. It is called sinus tachycardia. And then we have another one, which is we are talking about arrhythmias. Now, where we have said beating too fast is called tachycardia. You get it? So we have supraventricular tachycardia. We have supraventricular tachycardia and ventricular tachycardia. That one you should note. Supraventricular is above the auricles. The auricles are supra. These ones are supraventricular from here to up. That is the auricles, supra. Cut here. Now look, cut the heart down and up. This one brings blood down. These ones bring blood down. So supra is called supraventricular tachycardia. Down is called ventricular. So what are types of supraventricular tachycardia? If you are asked, what are the types of supraventricular tachycardia? Sinus rhythm tachycardia. This means the sinoatrial node is beating too fast that the ventricles are contracting and relaxing so fast. You get it? That one is called sinus tachycardia. Sinus tachycardia. But there is another way you can get. When this is taking here the electrons, you will find there is another node, a very funny node that we don't know where it came from. It just comes by itself from the other side here, and it is reversing as sinoatrial node is giving its impulses. The other one node here is giving back its impulses so fast. We don't know where it's coming from. It is called focal atrial tachycardia because it is on the other side of the heart, the left side of the heart. It is called focal. So focal, remember we are dealing with supraventricular. These are ventricles. So supra is up. So supra tachycardia is up. You get it? This is what we are dealing with, supra tachycardia. So we have said the first one is the sinoatrial node in the right is beating so fast. That is this one. Is when it's beating so fast, we call it sinus tachycardia. When there is a focal point somewhere here, we don't know where that focal point is, but it is giving us some electrical impulses. Maybe there was a mistake and then something happened and there was a focal point that is sending some impulses faster again, and it is returning back to the sinoatrial node. We call it focal sinus tachycardia. You get it? Focal sinus tachycardia. We are dealing with supraventricular tachycardia. And then we have some the focal points. It reaches a time, instead of giving more than 100, it's giving so faster that is above 200. Those ones are not tachycardias, because if it is above 200 now, even the heart itself will lose the contracting and relaxation. What will it do? It will be doing like this. Those ones are called fibrillations. fibrillations, because tachycardias are, so let's say, because it's between 60 and 100, so we say the normal is 80, it's like poo, pa, poo, pa, poo, pa, poo, pa. But tachycardia, poo, pa, poo, pa, poo, pa, poo, pa. The sinus, this one is sending signals so fast, poo, pa, poo, pa, poo, pa. But there is another focal point that has just risen. We don't know where it came from. It is giving faster beats. Even the heart itself cannot pump blood. It is called fibrillations. You get it? Focal fibrillations. Atrial fibrillations. It is called, because these are the atriums, it is called atrial fibrillations. Atrial fibrillations. Fibrillations. It is fibrillating. You get it? Now, we have talked about that. But you remember, when it is above now, fibrillations have stopped and it has gone so fast. We get something called atrial flutter. Now it is not pumping, electrodes are weak, and your heart is just still. We call it atrial flutter. Atrial flutter. You get it? We call it atrial flutter. We started by sinus tachycardia, and then we went to a node somewhere which is pushing so faster, which is called focal, because it is not the normal way, it is outside. We call it focal atrial. Yes, we call it focal atrial tachycardia. But there is something else that is so funny when it comes to complications of the heart. And this one is so funny, we can't even explain it. We have a point that is producing some, let me check them out, just a minute, guys. That is producing the same, that is producing the same impulses, and it is coming back, and you get it, the same impulses, and it is coming back to the mitral tract, and it's coming to the atrioventricular node, and then it is taking it back. It's not taking the right direction. It is coming here. Instead of going down, it takes this path, goes to the focal point, and comes back. This one is called atrioventricular nodal reentrant. It is circulating tachycardia, because now it is not going the normal direction. We call them atrioventricular nodal reentrant tachycardia. It is coming back. You get it? Atrioventricular node reentrant tachycardia. It's not going the normal direction. So remember, we are talking about the upper part. Those ones are called supraventricles. Ventricles are down, so we are talking about the supraventricular issues. You get it? So let's continue. And the last one, we were talking about something that is so funny. The same funny. Instead of reentrant, it is giving one direction and stops. Atrioventricular reentrant tachycardia. Instead of following the nodal pathway, it is following a wrong pathway and it stops. We call it atrioventricular tachycardia. Just like that. You get it? So these ones are most important when it comes to supraventricular tachycardias. Now, we have talked about when we started, we talked about how the impulses normal. We say the normal heartbeat should be 60 to 100. 60 to 100. Now, we go to another one called ventricular, down here, the ventricular. tachycardia. You see, we are talking now about wrong rhythms. We are talking about wrong rhythms, rhythms that are not normal. That's why I say it is called arrhythmia. Arrhythmias are rhythms that are not normal. They are just rhythms that are beating. And from their first, if you are coming in right now, it's important to check. You start from the beginning because we learned how a normal, the normal track is taking. But now these ones we are talking about, they are abnormal. They are not normal. That's why they are called tachycardias, arrhythmias. And we have said we have sinus tachycardia, focal sinus tachycardia, atrial fibrillations. We have said we have atrial flutter, where it is now just vibrating and not contracting. And then we have atrioventricular nodal re-entry tachycardia. And then we have anteroventricular re-entry tachycardia. And then we have another one, which is called ventricular. Now let's deal with the down. Because even down here, your heart can have a problem. You can have a fibrillation, a defibrillation. So what are the problems that we can have in the ventricles? We can have a problem called, let me give you this. We can have a problem called which is called ventricular tachycardia. The ventricles can beat so fast, above 100 beats per, because you have said it's 60, 100. When the electric impulse is coming down, it is beating so faster. So what do we call the fast? You can have one place that is sending a lot of signals, and it's one. It is called monomorphic tachycardia. Because it's one, we call it monomorphic tachycardia. Mono is one. But you can get several places within the bundle of His. This green thing here that is sending signals down the ventricles, it is called bundle of His. Several places that are sending several impulses. We call them polymorphic. So we have said monomorphic tachycardia, but we have polymorphic. Tachycardia. Polymorphic tachycardia, because there are many. Poly means many, and many of us we understand poly meaning. Poly means many. So when we come to polymorphic and monomorphic, we have another one. I think those ones is pathology. When your ventricles have problems like the MI that we talked about, So what we talked about down here, this one, you can have a rhythm that is beating so fast, and monomorphic with ST elevation, with ST. You see this ST elevation. So sorry, let me show you this ST. So the ventricles are beating so fast, they have a problem, and what we are having here, when you check into an echocardiogram, the ST is elevated. This is a sign that This is a sign that you may be having a problem, like your muscles may be having a problem of having what? Ischemia. And you know ischemia is lack of oxygen. Sorry, these lights are bringing chaos. Okay. Yes, that's right. These muscles may be having a problem. Maybe lack of oxygen, because there is a place that is having there is a place that is lacking oxygen. There is a place that is lacking oxygen. So here we'll see this ST is elevated. It will go like this. It will go like that. ST elevation. That one means it is an emergency, and you really need to take care of that emergency, because when your heart muscles are not getting oxygen, you see, it is an emergency. That one is an emergency. So we have talked about polymorphic, monomorphic, and with ST elevation, or with QT elevation, or with QT elevation. Those ones need a proper attention, because a patient can die. Because if the ventricles are not getting oxygen, a patient can die. Now, we check out some issues here. There is what if we don't have faster beat? We have a slower beat. Now, tachycardia, we have said, is faster. Tachycardia, we have said, is faster. Let's talk of the slow beat, which is it is called bradycardia. Bradycardia. What if it is slow? When it is slow, and which one do I use? Let me use this one. It is slow and it's above here, we call it sinus bradycardia. But when it's slow and it is within the ventricles, we call it heart block. And in heart block, they are divided into two, morbid 1 and morbid 2. You get it? Morbid 1 and morbid 2. So when you are dividing them and checking them, you should divide bradycardia slow. It is below 60 beats per minute. And I think today, up to there, it is very enough, because I need some people to go slowly on this, so that they can learn and get to know. So anyone with a question up to there, I will not go up to there, above there, because I know if I go above there, problems with questions will be there that are confusing, and some people will see that we are moving the syllabus too faster. This one is going up to a week. This is a lesson for the whole week. So today we have learned about the normal conduction pattern of the heart, the opposite, which is the tachycardias. We have known about sinus tachycardia. We have known about ventricular tachycardias. We have learned about bradycardia, slow. So anyone with a question? Tomorrow we will continue with it and know how the nodules beat, the nodes here, how the nodes beat and how they retract, and what keeps them, the sympathetic system, the parasympathetic system. And then we will continue to check even what makes your heart to beat like that. What makes your heart to have those tachycardia, fibrillations? Fibrillations are those faster tachycardias that you cannot even, you see. Now, anyone with a question? I'm waiting for a question. I know people today are very confused, but if you rewatch, you will learn slowly by slowly. Anyone with any question? Yes, anyone with a question? I'm waiting. What causes stroke? Stroke is totally different from what we are working on. This is faith. Stroke is from, wait a minute, faith. Stroke is from the brain, and it means part of your brain is not getting oxygen. It means part of your brain is not getting oxygen. So if part of your brain is not getting oxygen, you will get stroke. And we will talk about stroke. Today we are in the conducting system of the heart, but I want you to know that stroke is whereby part of your brain is not getting oxygen and it is dying off. So the continuous pattern of innervation of your brain dies off. That is stroke. Any other question? We will learn more about stroke after this. So don't be worried. You will learn more about stroke. Anyone with any question? I've just introduced some topic, and I know people will rewatch to understand what are fibrillations. So if you don't have any questions, my friends, it's okay. We wrap up. If it is okay, we wrap up because whatever I've said is too much for some people, and they need to learn slowly by slowly. So we'll meet tomorrow to continue on this or tomorrow and know what brings these problems. We have said the problem we are talking about, we started by knowing the normal, and then now no, stroke is the condition of the brain. And then now we have talked about tachycardias, the abnormal. Now tachycardias are abnormal. Whatever topic that is here is called abnormal because it is atrial fibrillations, you get it, faster beating and abnormal beating, slow beating. So tomorrow we'll continue about it. It's a long topic. Hope everyone will be there like today. Thank you so much for tuning in, and let's continue supporting each other. Bye. See you tomorrow as we continue with the topic on fibrillation. This is called cardiovascular. Bye everyone. See you tomorrow. Why does the heart get smaller than it should be? Tomorrow, that topic is coming tomorrow. Why the heart is coming smaller than it should be. It's called atrophy. Atrophy. There are several issues that are related to atrophy. Oh, Barbara is here. Barbara, sorry, you just rewatch. We started by normal and we got to complications. So if you are getting here now, don't worry, just rewatch. It is very interesting. Today has been so interesting. And I thank everyone who has said I'm a good teacher. Thank you so much. I appreciate. Bye. See you tomorrow on the other topic as we continue the topic.